All right, good afternoon, everyone. Thank you so much for joining us. The time is now noon, and in the interest of being respectful of your time, we'll go ahead and get started here as folks filter in. My name is Dan Callahan. I am a communications specialist with the Minnesota Board of Animal Health. We'll be moderating today's session. Just a few housekeeping notes. As you come in, you may notice you are muted and there is no meeting chat. There is a Q&A box. If you have questions during the presentation, please feel free to drop them in the Q&A box. We will handle them as we move through the presentation, and we've also allocated some time at the end of the webinar to handle questions. Uh, with that, if you, oh, well, there you are. With that, I'll pass it over to Dr. Stacy Holzbauer from the Minnesota Department of Health and Dr. Steve Kivisto from the board.
Hi, good afternoon, everyone. This is Dr. Stacy Holzbauer, a state public health veterinarian with the Minnesota Department of Health, and I'll be starting us off. I really want to thank Dr. Kivisto and Dan for inviting us to be part of this webinar series. Rabies surveillance in Minnesota is truly a One Health effort and a great collaboration between the Board of Animal Health, the Department of Health, the Veterinary Diagnostic Lab, and the Department of Health's Public Health Laboratory. Next slide, please. So we'll start off talking about rabies pathogenesis. Next slide, please. So just some basic rabies facts. The rabies virus is an RNA virus. It infects mammals only. It does not infect birds, reptiles, amphibians, or fish. And it is a fatal illness. In people, there's essentially no treatment. And in animals, once symptoms start. And so rabies vaccinations in people are given after exposure to prevent symptoms. It's very fragile in the environment, and it's quickly inactivated by sunlight, UV light, desiccation, and detergents. And saliva is essentially considered non-infectious once the saliva has dried. Next slide, please. So how is rabies transmitted? There are three possible methods. The most common method for both people and animals is through a bite from a rabid animal. However, copious amounts of saliva from a rabid animal that enters into the eyes, nose, mouth, or fresh open wound can also be a source of transmission, or infected CNS material from a rabid animal that also enters into the eyes, nose, mouth, mucous membrane, or a fresh open wound as well. Next slide, please. So rabies cannot be transmitted through indirect contact. We receive lots of questions, both here at the health department and also our colleagues at the Board of Animal Health, about concerns about environmental contamination, transmission of rabies through the environment, of water, food, objects, or services. This is not how rabies is transmitted. It's not transmitted through petting or handling of an animal, contact with blood, urine, or feces, or saliva contact with intact skin. The virus is essentially found in the saliva and the neurologic tissue, brain, and CSF. Next slide, please. And so rabies pathogenesis starts at the bite wound. And so what happens is a rabid animal has the rabies virus in their saliva. It is inoculated into an animal, into the bite wound, and the teeth are essentially serving almost as that a needle to inoculate the virus into the muscle tissue. From there, the virus goes under replication locally and enters into the peripheral nerves. It then follows the peripheral nerves to the central nervous system. And so the virus, once it enters the nerve, it typically moves about 0.5 inches per day. Once it reaches the spinal cord, it multiplies rapidly and then rapidly moves up to this from the spinal cord into the brain. And there it settles into the cerebellum and midbrain brainstem, and then in the final stages settles into the parotid glands. And at this point in time, the animal can transmit the rabies virus. Next slide, please. And so rabies incubation period is really based on entry point. And so bites to extremities have a longer incubation period than bites that occur closer to the central nervous system. And so we take that into account when we do our animal bites and risk assessments. Next slide, please. And so the size of the animal or the person also takes that into account. So the smaller the body size, the shorter internal virus path, both for children and for small animals as well compared to their adult counterparts. Next slide, please. And so the incubation period in animals can vary, again, depending on the location of the bite and the severity of the bite. And so with dogs and cats, it's been documented from 10 days up to 2 months or longer. Cattle, there has been documentation of as soon as 25 days to 150 days. Most of this information is based off of research with vampire bats, but we did have a documented case in Minnesota where we knew when the bite occurred. And when the cow developed clinical signs, and that was an incubation period of 6 weeks and 3 days. Sheep, goats, and cattle horses are similar to cattle, but with wild animals, we do not have great data. And so we treat wild animal bites differently. Next slide, please. And so the clinical course of rabies in dogs and cats, again, we want to remind folks that an animal cannot transmit rabies until the virus enters the salivary glands. The time between onset of clinical signs and the virus being present in the salivary glands has been clinically proven, but we have not tested this in the whole gamut of wild animals that potentially bite animals or humans. But once an animal shows clinical signs, we know that they could not have had the virus in their salivary glands for more than 3 to 4 days. So after a bite to a person, we observe an animal for 10 days, which essentially includes a safety factor. So doubling that time frame from the time that the salivary glands would have entered the rabies virus would have entered into the salivary glands, that prodrome period. And so if the animal had rabies at the time of biting, it would be incredibly sick, if not dead, within that 10-day time frame. Next slide, please. And so here we show essentially the clinical, a graphic of that clinical course. And so you can see this is showing when the virus is present, both at the entry site, so the site of the bite wound, and also the CNS, the levels of virus in the CNS and also in the salivary glands. And so during that incubation period and prodrome period, we are starting to pick up virus in the CNS, but we don't see virus in the salivary glands until right before the animals develop clinical signs. And so we will be coming back to this graphic to help understand how we treat animals if they are the animal that is biting someone versus whether the animal has been bitten by a rabid animal. And so it depends on whether we're looking at the time frame of the incubation period or the prodrome, or if we're trying to determine if that animal was infected with rabies at the time of a bite. Next slide, please. All right. So moving on to rabies variants and geographic distribution. So there are multiple different rabies variants in the United States, and they are species specific and host adapted. And so in the US, there are 7 antigenic variants for terrestrial carnivores. Most of those have originated either from bat or dog variant lineages. The variants from bats are believed to date back to the 16th century, and the variants from dogs essentially occurred during European colonization, so during the 18th century. Next slide, please. And so the 2 rabies reservoir species in Minnesota are the striped skunk and 8 species of bats. Next slide, please. And so this map just shows the common reservoir rabies by locations in the United States. And so bats, of course, because they are mobile, cover the entire United States. However, we do see differences in our terrestrial reservoir species. So the raccoon is the major terrestrial reservoir on the East Coast. The skunk accounts for the terrestrial reservoir in the central United States. And then we see in Arizona and New Mexico, fox and skunks. And in Alaska, we have the Arctic fox, and in Puerto Rico, the mongoose is the main terrestrial reservoir. Next slide, please. And so the terrestrial rabies cycle in Minnesota is essentially a skunk bites another skunk, which bites another skunk. And then we have spillover into either our livestock or we can have skunks bite people, but mainly what happens is people tend to be exposed to infected livestock, unvaccinated pets, or bats. Next slide, please. And so I just wanted to show you some of our Minnesota rabies data over the years. And so just a caveat that when we look at the epidemiology of the animal rabies data in Minnesota, these are all animals that have been tested for rabies in Minnesota that are submitted by people who have chosen to have the animal tested. So there's really no random sampling of wild animals for rabies testing. So we have to take into account that what we're showing you doesn't reflect the true infection levels of animals that are in the wild. So these are convenient samples that are sent to the veterinary diagnostic lab and tested at the Department of Health's Public Health Laboratory. Next slide, please. And so in 2025, we had 34 positive bats that were tested here, 3 positive skunks. We did not have any cattle, even though we had a record year in 2024, 2 positive cats, and no dogs. Next slide, please. And so this map is on the Board of Animal Health's website, and it just shows the rabies cases by species. And so you can see that, again, reflecting the convenience nature, we see more cases in areas where there are more people. And so Hennepin County is bright green, but we get a lot of bat submissions from Hennepin County, especially in some of the older homes. We see most of our skunks in central Minnesota and also western Minnesota as well. Next slide, please. And so this graph just shows the rabies trends of bats, skunks, and domestic animals in Minnesota since 2005. And so you can see that we see peaks and valleys of our positive numbers, but that our skunks and our domestic animals tend to mirror each other, whereas our bats are really dependent on that human-bat interaction. Next slide, please. And so these charts show the animals tested for rabies by species and test results since 2003 to 2025. You can see that we test a large number of dogs and cats over this time frame. And most of the animals that we test for rabies do test negative, except for skunks. Almost 50% of the skunks that we test are positive. And so really a skunk that is submitted is considered positive until proven otherwise. We do, percentage-wise, see a higher percentage of cattle that we test compared to other livestock species, and about 4% of the bats that we test are positive as well. Next slide, please. So we do see seasonality, especially with our bats. So this graph shows the bats submitted for rabies testing by month. And we see a huge increase in August. And this is essentially a combination of two major factors. We start to see our migratory bat species. We have 4 of those in Minnesota that are starting to move out and then are looking for places to land as they head south. And then we also have our hibernating species that are and our juvenile bat species that are trying to find new places to be. And so they will be looking for attics and homes to overwinter while they're hibernating. But we do get bat submissions every month of the year, and we do get positive results essentially every month of the year as well. Next slide, please. And so the importance of vaccination, especially for our companion animal species, really cannot be overestimated. And so veterinarians really play an essential role in human rabies prevention. And so this graph shows the rabies cases in humans and domestic animals since 1938 through 2018. And so you can see that once mass vaccination of dogs started in 1947, we saw a dramatic decrease in not only the number of domestic animals that tested positive for rabies, but for humans as well. And so, vaccinating our animals really is not only protects our companion animal population, but also people as well. So next slide, please. So then to move on to the Minnesota rabies rules. So the state laws that are written about the rabies virus are in the Minnesota Board of Animal Health's rules and code. And so these are enforced both by the Board of Animal Health and local authorities. And there are 2 main areas that these rules focus on. The first one is the management procedures for animals that are exposed to animals that are infected with rabies. And Steve will be, or Dr. Kivisto will be covering that. And then the second is the management of animals that bite humans. And the second part of these rules is actually what takes up the most of all 4 entities that are doing rabies surveillance. So we'll talk through that, and then I will pass it over to Dr. Kivisto. So the next slide, please. So when an animal, oh, sorry, go ahead. So when an animal bites a person, there's a maximum of 3 options. We can first make sure that the animal didn't have rabies by doing a confinement and observation. We can make sure that the animal didn't have rabies by testing the animal for rabies, or we can protect the person that was bitten by giving them the rabies post-exposure prophylaxis, or rabies PEP. There are many nuances to this, to these 3 options. So we'll start with reviewing the confinement and observation. Next slide, please. So a 10-day confinement and observation is used to make sure that the biting animal did not have rabies when they bit someone. And so by confinement, we mean that this animal is restricted in a way that the animal can be found and is not able to wander away. And so we want to confine this animal away from other animals and essentially assign one person to care for the animal. And this applies to domestic animals only. There is no confinement and observation for wildlife. Next slide, please. And so, again, getting back to understanding where we are in the rabies pathogenesis, we are trying to determine with the confine and observe, did the animal that bit the person were they shedding the rabies virus at the time that they bit the person? And so we're far into the rabies pathogenesis and essentially trying to determine, were they shedding the virus at the time of bite? Next slide, please. And so the enforcement of the confine and observation written into the laws is by local law enforcement and animal control. And so this really is a local issue. Most often, these animals are confined at the owner's home, but depending on local regulations, they may be required to be confined at a clinic or animal control if the animal is not current on rabies vaccination. If illness develops when an animal is under confinement, it must be reported to the Minnesota Department of Health. And if it's suggestive of rabies, that animal must be euthanized and tested. And so this is written into the statutes. Next slide, please. So again, just to review, when we have a dog, a cat, or a ferret that bites a human, we have the option to do a 10-day confinement and observation or euthanize and test that animal. I think there's, if you can click. The vaccination status of the dog, cat, or ferret does not affect the 10-day confinement period. Again, we're trying to determine if that animal was shedding virus at the time of the bite. The only time that we will take vaccination status into account is when there is a facial bite, because again, due to the location of that bite, we don't have the luxury of time of waiting for that 10-day confinement period, especially if it's a severe bite. Again, just because the bite wound is happening so close to the central nervous system. Next slide, please. So livestock that bite humans can also be confined and observed for 10 days. So the rules are the same as dogs, cats, and ferrets. Next slide, please. But wild animals do not have a confinement period. Again, we do not have the scientific studies to know essentially when these animals will be shedding the virus in their saliva and able to transmit. And so we only have two options in these situations, to either test the animal or to treat the bite victim with rabies post-exposure prophylaxis. And so if you have clients that have this situation, please send them to their doctor or to MDH for advice. And we're happy to assist 24/7. Next slide, please. And so bats are a different story. And when we look at domestically acquired human rabies cases in the United States, they are almost always associated with bats. So bats have tiny teeth that make tiny bite marks. And so it's not uncommon for people to have a known bite and to look at their hand and to think that they were not bitten, even though they felt it. So you can see just with the arrows how tiny these bite marks can be. Next slide, please. And so because of this, we have very conservative recommendations for bat exposures. And so what constitutes a known exposure is, first of all, of course, if the bat bites you, or if the bat flies into you, or if you have any bare skin contact with the bat and you're not 100% confident that the animal did not bite you. Possible exposures include waking up to find a bat in a room, or if a bat is in a room with an unattended child or a vulnerable adult or any adult or person who is not able to communicate what happened. Next slide, please. And so we recommend rabies post-exposure prophylaxis, both for those known exposures and those possible exposures. And so, again, these are incredibly conservative recommendations, but the rationale is that these bite wounds and bat teeth are tiny and bites can go unrecognized. And around 4% of the bats that we test are positive for rabies, but it's impossible to physically look at a bat to know whether it's going to be positive or not. If there are any possibilities that someone had physical contact with that bat, we do want them to catch the bat and test it for rabies, even if there isn't a known bite. And if we can't test that bat and we cannot rule out contact in our conversations and our risk assessments, then we do recommend rabies post-exposure prophylaxis. Next slide, please. So then just a little bit about animal rabies testing here in Minnesota. So the DFA, the direct fluorescent antibody test, is the gold standard test at this point in time. And this is performed at the Minnesota Department of Health Public Health Laboratory. And essentially we have 4 options for test results. So we have a negative result, which is meaning that the animal could not shed virus at the time of death. And so no recommendations for post-exposure prophylaxis if there was an exposure. A positive, meaning that the animal was infected with rabies and could be shedding virus in their saliva. And this is almost a 100% sensitive. And so it really identifies our true positives. We can have an equivocal result. This is usually due to background staining, where it's not possible to determine whether it's the axons that are fluorescing or just background staining. And so those results are sent down to the Centers for Disease Control for PCR testing. However, we do not get those results back in a timely enough manner to make clinical decisions on those. And so we do treat any equivocals as a positive and an unsatisfactory result. And so this is when, again, we're not able to distinguish the necessary brain parts. The test is still run, but a negative cannot be reported out. And so we treat those when it comes to our recommendations also as if they were positive. Next slide, please. So when with rabies testing, there is written into the statute that if a dog or cat is euthanized and has bitten somebody within 10 days, it must be tested for rabies. And so many clinics have forms where they ask this question, but we do really ask veterinarians and staff to ask the client if the dog and cat has bitten someone and not just provide a form to sign. It's not uncommon for us to find out about bites following euthanasias, and then heroic efforts can happen to test those animals, including, digging up animals that have been buried, but often those results end up being unsatisfactory. And so we want to do our best to find out this information beforehand. There are options if your client does not want to test. Especially we'll run into situations not uncommonly where the animal is, has an underlying chronic illness, and the owner, in trying to care for it, is bitten. And so the animal can be euthanized and tested for rabies with individual cremation. This is an option that the VDL does offer through additional forms and logistics. Or the animal can be confined and observed in home and euthanized after the 10 days. Then there's no test that's required. Or it could be confined and observed in the clinic or another place, and then euthanized after that 10-day confinement and observation period has occurred. So all animals can be delivered to the veterinary diagnostic lab in St. Paul, but both NDSU and SDSU VDLs are also options, especially for our friends in the western part of Minnesota. At the VDL, the testing cost is $23 for in-state animals. Out of state is $25.30 with a $10 a session fee. This is the cost of rabies testing. This does not include, the cost to the client that for shipping and euthanasia. There is an additional $50 fee for any after-hours submissions. So they will take submissions 24/7, but it does incur additional costs. And you are responsible for collecting that fee from your client, and the VDL will bill the clinics directly. Next slide, please. And so this is the specimen submission form. We do ask that you complete all of the information, because we do use all of it when we do have an animal that has a non-negative test to help us with our risk assessments. This is available online at the VDL, and then also online at our representative agency websites as well. Next slide, please. And so for samples, we do require bilateral medulla, cerebellum, and hippocampus. If those three parts of the brain cannot be identified by our laboratorians, it'll be considered an unsatisfactory sample. When I was trained many, many years ago, I was trained to split ruminants in half, put half in formalin, and the other half of the ruminant brain fresh for rabies submission. But however, we have detected unilateral infections in ruminants, and so that's why the entire brain should be submitted fresh. And then other diagnostics can be completed after the rabies testing is done. Please no shooting or crushing the head. It's very common for us to get, especially bat submissions, that the skull has been crushed. And we do recommend entire head submissions for large animals, or entire bodies of small animals, just to help ensure that we're getting all parts of the brain for an adequate test. Next slide, please. All right, so then acquiring and submitting animals for testing. So some additional considerations to consider, especially in the summertime. It's really important that we cool down and pack those animals well. And so consider the size of the animal when cooling. If you're using a freezer, leave the heads of larger animals or larger companion animals outside of the bag if possible, so that the bag that you've put it in is not actually trapping the heat in the freezer, so that you're not having those animals decompose while you're attempting to cool them. So chill the specimen before packing, but do not freeze. And then double bag, put lots of ice packs around, and then fill the space with paper, and then attach the submission form in a plastic bag. Next slide, please. So hand delivery is best if at all possible. Otherwise, if you have to ship a rabies specimen to the veterinary diagnostic lab, either here or in North Dakota or South Dakota, overnight shipping only. Please do not use our U.S. Postal Service, and do not send out a specimen on Fridays. It is not uncommon for us to get unsatisfactory specimens, or brain mush, as our VDL friends will sometimes label it, if a specimen sits in a warehouse over the weekend. Live vats can be delivered to the VDL during normal business hours. However, if you do need to submit a specimen over the weekend, the VDL does have a phone number where you can reach an on-call student, and they will meet you at the veterinary diagnostic lab to receive the specimen, but this will incur an additional $50 fee. Next slide, please. And so what happens is the VDL necropsies and prepares the brain sample, which is then couriered over to the public health lab for testing. And so there's an 11 a.m. cutoff at the VDL for next day results. Later deliveries will have results in 2 days. We can offer expedited testing, but this is in consultation with the epidemiologist at the Department of Health to determine if it's needed. And we really reserve these for severe facial bites. But certainly give us a call if there is a situation where we would need expedited testing. We reach out to the veterinary clinics as soon as we have any non-negative test results to let you know those results and do a rabies risk assessment. And then for any negative results, the VDL does email those results at 4 p.m. Every weekday. All right, next slide, please. And so then just to reiterate, the 10-day confinement and observation applies only when a person is bitten. If a dog bites another animal during this 10-day confinement and observation, that does not legally apply. And so local law enforcement and animal control do enforce this 10-day confinement and observation as well, and not the Board of Animal Health or MDH, although we are often giving advice on how to do this. And veterinarians as well are not responsible for enforcing this requirement. This is a local law enforcement and animal control. And we are always happy to assist if there is not cooperation happening between the two parties. All right, and I believe with that, I'm turning it over to Dr. Kivisto.
Yeah, thank you, Dr. Hulsbauer, for all that information. I much appreciate it. So, yeah, I'll take over from here. So, as Dr. Hulsbauer pointed out, the Department of Health will manage the cases where people have been bitten, where there's potential rabies exposure. The Board of Animal Health deals with the animal end of it. So whether that be a dog biting another dog, or a cat, or a wildlife biting someone's pet. And there's a little box that highlights it. So if you go to, so speaking of situations where a dog, cat, whatever is exposed to a wild animal, or an animal that's been tested for rabies, found to be positive, you go to our website and there is a drop-down box, programs, rabies. You'll have to scroll down a little bit, but in the bitten or exposed domestic animals, on the right-hand side, there is a flow chart there. So the first thing I would say is, if it's during business hours, or honestly, at the end of the presentation, I'll have our phone number. You can give us a call, and we are more than happy to walk you through what should be done and talk to the owners for that matter. But on our website, there is a flow chart here. I won't go through every one of these details, but I'll just point out a couple of facts, and I'll reiterate this again, maybe a little bit on the next slide when it comes to skunks. But the biggest difference here is vaccinated animals that are currently vaccinated versus those that are not. And when you have an animal that is currently vaccinated, the management of it is significantly easier on both the pet owner, the pet itself, and quite frankly, us at the Board of Animal Health. So if they are currently vaccinated and they are boosted within that 72 hours of exposure, then what we do in those situations, we just will confine and observe for 45 days. And that kind of going back to our earlier definition of what that means is that they're just not exposed to other animals. Typically, one individual is taking care of them, monitoring any signs of rabies, and then reporting if any signs of illness. On the other side of it, there's also the documented vaccine, but overdue. It's kind of the similar, we get them boosted within that 72 hours. But then we have a little more of a range, and it kind of depend on some of the circumstances. For instance, if it was a bat, was it a positive bat? Was it unsatisfactory? Was it not even tested? So our recommendations can vary from that 45 to 120 days, depending. But the vaccination at some point in time, and then getting them boosted, it makes all the difference in the world. Uh, the other thing I will mention, if it is after hours, it's on a weekend, you can't get a hold of anyone, and you've got a situation where you have a person comes in with the dog that got into it with a muskrat, or choose your favorite wild animal to tussle with. Treat the wounds as you would normally treat them, and then vaccinate for rabies as soon as you can. One exception to all of this, when it comes to whether an animal tests positive or negative, we consider any skunk bite or interaction to be a positive rabies exposure until we're proven otherwise. And going back to the information presented earlier, the percentage, the percentage of skunks tested when close to 50% of them come up positive, that just tells us that they're definitely they're a high risk animal when it comes to rabies. So we have interactions with skunk, whether that's fighting or getting sprayed, we consider those rabies exposures. So if you get that call from the client and they ask, how do I get that skunk smell out of my dog? Certainly provide the information to the best of your ability, but also ask the question, is your dog up to date on rabies? And if you don't have that information, get it up to date on rabies. And in fact, even if it is up to date on rabies, get it boosted as soon as possible. Again, ideally within that 72 hours. And that would be, even we were just talking about, they don't know if they got into a tussle, but they went outside, they came back in stinking like skunk spray. It's better safe than sorry in that kind of situation. So we would recommend, if you were to call us, to booster it for rabies. So the other thing I think we want to kind of drive home is vaccinate. Animals that have been vaccinated, again, the management is so much easier on everyone. There is currently no statewide vaccine requirement in the state of Minnesota. So some cities, townships, counties may have their own rabies vaccine requirements, but statewide there is none. I think it's safe to say that the Board of Animal Health and our colleagues at the Department of Health would prefer that there was one, for a number of reasons. I mean, the rabies vaccines are safe and very effective. And again, going back to a dog, cat, ferret that is up to date on their rabies vaccinations, it can change 6-month quarantine to a 45-day confine and observe. Again, that's just easier on everybody. And it can save the humans who potentially have been bitten, the pain, expense, and anxiety associated with post-rabies exposure prophylaxis. So vaccinate, vaccinate, vaccinate. And, I guess if you get the ear of someone who makes decisions like this, maybe suggest perhaps on our behalf that a statewide rabies vaccine isn't a terrible idea. If you have an animal that is under 12 weeks of age, and most rabies vaccines, right, they need to be 12 weeks or older, but there's potential for exposure, give us a call and we can kind of walk through. There are some options there. If we're talking again about an unvaccinated animal that we know has been exposed, an animal that's tested positive for rabies, potentially a skunk, our number one recommendation, unfortunately, will be euthanasia. But there might be circumstances, again, on an individual basis, we would talk through where vaccinating an animal under 12 weeks of age may be better than nothing. So just keeping that in mind, but definitely give us a call if that comes up. And just a note, we get this question quite often, when if an animal's overdue, and they come in and get a booster on the rabies vaccine. And sometimes we get these calls from veterinary clinics. Sometimes we get them from owners of pets who've been recently revaccinated. If they've ever had a rabies vaccine, and that first one we always give is only good for a year, and then that next one is good for 3. Even if they're overdue, that next rabies vaccine they get is good for 3 years. And you don't have to take my word for it. The Board of Vet Med has, and this was a number of years ago, did a little study on vaccine patterns in veterinary clinics and released their conclusion with this rabies vaccination guidance document there. And then also you could, when you have some of your spare time, check out the rabies compendium, and it will also confirm that information, that next rabies vaccine, if overdue, is still good for 3 years. Now, of course, there are the exceptions of the like the Peervax or the non-adjuvant vaccines, which are only labeled for a year. Obviously, they're only good for a year, but anything that has a 3-year label, once boosted, should be good for 3 years, even if overdue. Couple of things to point out: we do have on our website this animal bites and rabies risk guide, that you can certainly check out and I think Dan's going to be either dropping links in the chat or we send them out via email. And on that note, I will pause, and you can see that at the top email there is the Department of Health's Zoonotic Disease Unit. If you have questions about human exposure, give them an email, or you can give them a call at the bottom phone number. And then if you have questions about animal rabies, you feel free to email myself there, or you can give the Board of Animal Health rabies line a call, and we'll help you out to the best of our abilities. So with that note, I will pause and throw it over to Dan and see if there are any questions.
Thanks, Dr. K. At this point, I don't have any questions submitted. While folks are eagerly typing up their questions, just to let you know, I did drop a bunch of links in the Q&A for many of the things that were discussed during this presentation, including contact information, the rabies compendium, the animal bites and rabies risk guide, and then the rabies pages for both the Minnesota Department of Health and the Board of Animal Health, depending on what you're looking for. With that, as I said, folks, please feel free to drop questions in the chat. I know it was a very comprehensive overview of rabies in Minnesota, and hopefully all your questions were already answered. If they were not, and you think of something later, please feel free to reach out to the Zoonotic Diseases Unit and Dr. Kivisto here at the board, either by phone or by email. Looks like we got a question here. All right, the question is, we have debated how long is too long when a rabies vaccine is overdue. Is there a limit? 10 years? Less?
Based on the rabies compendium, there does not appear to be a too long overdue. That's the short answer to your question. So I guess I'll just leave it at that. I've yet to find information to say otherwise. But I will ask Dr. Holzbauer to see if she's had any hidden information there on that note.
No, I would completely agree with you, Dr. Kivisto. As long as they've gone through the full series, again, just that booster will bring them up to date. And we do see the same with people as well. If you've been pre-exposure vaccinated, there's never really an instance that we would, not or put someone into an unvaccinated status where they would need like the human rabies immunoglobulin if they were exposed. So if you're pre-exposure vaccinated and you have an exposure and you're a person, just the recommendation for rabies post-exposure prophylaxis is 2 booster vaccinations.
Well, on that note, and since this would definitely also fall in your category, I've personally have asked this question of my own physician, and I get asked by veterinarians from time to time, and I try to direct them your way. The rabies titers, right? And if anyone's gone to the MVMA seminar, well, there's offering rabies titers, and I suppose every physician is different, but mine has told me that to save your money, that you will be, uh, your treatment's gonna not depend on what your last titer was. It was just the fact that if you've ever been vaccinated. Would the Department of Health back up my physician, or should I be looking for a different doctor?
No, we would back up your physician. So this is a fairly recent change to the recommendations for what constitutes the pre-exposure recommendations. And so there are now risk categories, and I will drop the link to the CDC guidance in the chat here. I think I can. But most veterinarians fall into risk category 3. Veterinarians, and we very much advocate that essentially anyone in a veterinary clinic who is handling animals should be pre-exposure vaccinated. So this includes your veterinary technicians, your kennel staff, even your receptionists if sometimes they're, homing animals. So essentially, they would all fall into risk category 3. And so the current recommendations now for pre-exposure vaccination are to get 2 doses of rabies vaccine on days 0 and 7. So day 0 being the day that you start the series and show up to the clinic, and then another vaccine 7 days later. And then you have the option of either a one-time titer check after 1 year following that initial series, up to 3 years following that those 2 doses. And that would be the only titer that you would ever get if it's an adequate titer. Or the other option is to have a 1-dose booster given 3 weeks after that initial 2-dose series, up to 3 years later. And then you never need a titer check. And so I believe what most veterinary schools are doing is the 3-dose vaccine regimen. And if you go through that 3-dose vaccine regimen, you do not need to have a titer.
Thank you for Thank you for that. I'm relieved to know my physician is up to date.
He is.
All right, I do not see any other questions coming in at the moment. But I will take this opportunity to comment on a few things. Sorry, let me finish right when I'm ready. Uh, First and foremost, please follow us on Facebook. The board is available on Facebook, and it's where we post a lot of information about when we're holding discussions and conversations like this. It's a great place to get the latest information. Also, this webinar is being recorded and will be available on the board's YouTube channel. Within a few days, as soon as we can get it up online. But also, it's a great resource for our previous companion animal webinars. If you have not had a chance to watch all of those, that would be a great opportunity. I see here we have a question regarding which healthcare system can adequately assess a titer.
So just to clarify, is that a titer in a person or a titer in an animal, like a dog or a cat?
I'm gonna just jump at. I think it's probably a person, given the
Person?
conversation was on. Yeah.
Okay. All right. So most providers should be able to submit testing for people. It is a sent out to a reference lab, and there are, I believe, 3 different labs that offer that testing. But I think like most reference labs that are used, such as Quest or LabCorp, do offer rabies antibody titer testing, and it usually goes. They have a contract with one of those 3 labs. But if you're running into any issues with your provider, please don't hesitate to reach out to us and we can help guide them for getting testing.
Thank you so much. Last call for questions. We have about 5 minutes left here. Make sure that we are, as I said, respectful of your time. And if we can give you 5 minutes back, we certainly want to. All right.
Well,
Once. Go ahead,
yeah,
Doc.
well, yeah, just a quick note on the tennis racket, sort of an inside joke. It's not uncommon when we read the reports on how bats are obtained for submission. They usually involve some sort of object being swung at them, and often is a tennis racket. And we've come to the conclusion that this most decidedly is not the ideal way to obtain a bat, although I can understand the emotions probably involved with a bat flying around the room and grabbing whatever happens to be at hand, although I often wonder how often people have tennis rackets just sitting by their bed or in their kitchen or whatever it happens to be. But not being an avid tennis player, maybe that's a me problem. So it more often than not, when they submit it this way, they are crushed. So if possible, if they happen to have a butterfly net or something a little softer, perhaps in the garage, that can be a little more, maybe not more useful, but certainly going to get you a better sample.
Yeah, actually, not to plug MDH before Dr. Holzbauer can, but they produced a really wonderful video how to safely capture a bat. I just dropped it in the chat here for you.
Nice. Thank you.
Thank you, Dan. You beat me to it. But
All right. Going once, going twice. Thank you all so much. If you have further questions, please feel free to reach out to the Zoonotic Diseases Unit at MDH or to Dr. Kivisto here at the board. It was wonderful chatting with you all today. This video was recorded and is being recorded and will be available on our YouTube channel. I've dropped that link in the question box as well as all of our other videos, as I said. Yeah, thank you so much for your time, and we look forward to seeing you at the next video.
Thank you, everyone.
thank you.